Page, respiratory care practitioner, Sarah. Morning.
Good, little busy today.
Yeah, fairly busy, I have to admit as well.
Yes. I came here to discuss with you, you have this girl, yes, who was admitted yesterday.
Oh, patient 246?
Yes.
Yeah.
246. We are ready to send her home, but I think we need to discuss medication with her. Well, you called me, left me a message later here.
Yeah, I think it's important because this patient before, it says here that she has a history of asthma and seasonal allergies. She's been using the MDI and it's not really been effective for her.
Yes.
And so I was thinking of another option.
It was very scary last night.
Yeah, I was thinking about a DPI. What do you think about that?
The DPI, the problem with the DPI is that it's the coordination, and sometimes with the, with the patients, we try to help them to do not do too many steps.
Okay.
And I think something like a DPI instead of an MDI might work with her because she is strong enough to produce the effort that it needs for the medicine to reach her lungs.
Okay, then yeah, I think that's true.
Yeah.
Just looking at some studies here, and basically with all of our chronic asthma patients and bronchitis and emphysema, it does appear that the DPI is better because it has that actuation. So if they can't produce a high flow to inhale, that does seem to be good. So I think you're right there.
Well, depends on the medication also that you're thinking. And what we have in the market that can help her because she can be trained also with the MDI instead of the DPI. But I don't know what you're thinking about.
I think that's good, and I think we'll just need to explain to her how the DPI works, and of course breathe better and help cut down her wheezing. So
that sounds like you are already thinking in Breo.
Yeah, I think that's good. Now, do you think that we should give her start with 100 milligrams or 200?
I think 100, it's much better. 125 will help her, and we need to remember she's an 18-year-old girl.
Okay, that's true. So, and with that said, the corticosteroid will help with her seasonal allergies. So that will help there. We'll use it as a maintenance drug, since she's already taking her albuterol, but I think that we'll probably need to go over some of the side effects because she does have history of allergies. So maybe you can go over with her some of the common side effects of the steroid.
Yes, teaching her how to do the mouth hygiene after the medication and underline how important it is. Besides that, I don't think really too much trouble at her age.
Yeah, and I did check here, and it checked her charts. She does not have a milk allergy, so I know that sometimes the patient has a milk allergy. Breo may not be the medication. I did check her history, and no allergies for milk, so I think this is good, and I think we should go instruct the patient, get her discharged.
That sounds very good. She's going to be very happy.
Okay, let's go talk to her.
Okay.
Morning.
Hi.
Dr. Lee, may I come in?
Absolutely.
Hey, how are you this morning?
I'm alright,
Good. I hear you're sounding better. You ready to go back home?
Yes.
Good. Well, the great news is we decided to change your medication because you were taking this MDI steroid. I think this may have been why you ended up in the hospital to begin with. One of the problems with the MDI is that it takes coordination. And if you're having an asthma attack, it's hard for you to coordinate, even though this is your maintenance medication. And also while you're having seasonal allergies, you've been coughing a lot. So I talked to the respiratory care practitioner, and she and I both came to the conclusion. What we decided to do, you're originally taking fluticasone, MDI, inhaled corticosteroid, and now we're moving you to a combination therapy. We considered putting you on Advair, but given some of your history, we thought a better choice would be actually to use Breo Ellipta. So with Breo Ellipta, this is a combo drug, and as mentioned previously, it's a combo drug because you have the corticosteroid fluticasone, and you have the combination of vintenorol, which is your long-acting bronchodilator. Something to note is when the medication is getting low, it will turn red here, and that indicates that you're needing to get a refill. You will also notice that on the back, it gives you further instructions on how to use it. But if someone asks you what you're taking, now you know that you're taking Breo, and if you think about it, B is the second letter in the alphabet, so there's two drugs. The first is fluticasone, and the second is lutein. These are fancy names, but basically what happens is, this is what your airway looks like. See, it's tight, it's narrow. So the steroid is going to reduce swelling to help open it up. And then the bronchodilator is going to help even open it up further, back to its original diameter. And so you should be able to breathe better, cut down your wheezing, and you will feel better as well, okay? And you will take this one time in the morning, okay? By being a DPI, only thing you need to do is you will put it to your mouth, the medication, and you open up the cap, which the respiratory care practitioner will show you, and take a deep breath in. And you will hold it for 3 to 10 seconds. And that's why the medication will, the longer you hold it, the deeper it goes down to your lungs. Okay? And then you will slowly just exhale away from the device.
How, after one try of that, will it open? Usually they're going to take a couple times until...
Well, the good thing about this medication is one time is all you need, and it will work throughout the remainder of the day. So it's not an emergency medication, so you don't want to take it when you're having an asthma attack. But if you take this every day in the morning, it will help to maintain your asthma, so it's a maintenance medication. And by between 3 or 4 hours, you will start noticing a difference. And the more you take it, once a day, by the end of the week, you'll start feeling better. The problem is sometimes people take this and they stop taking it because they start feeling good. So just remember to take it every day, once in the morning, and you want to make sure to rinse your mouth out. Because with steroids, it can cause your mouth to get dry, and you can get an element on your tongue called thrush.
Is that the only side effect, or the...
Well, there's some other side effects as well. It can alter your weight, and it also can alter your sleeping habits and your eating habits. But if you start noticing any of those side effects, definitely call back and we will reassess you.
Okay.
And then there's a pamphlet in here too as well with additional questions. Okay?
Yeah.
So I'll have the respiratory care practitioner come in and she'll explain how to use the medication. Okay?
Great.
Okay. Best of luck to you.
Thank you.
Take care. Sarah? Okay, she's all ready for you.
Hi, good morning. I'm Sarah from Respiratory. I'm here to show you how to use your new medication, which is Breo. Let me sit with you. The doctor explained you what is the new medication you are going to have.
Yes.
And this is a new medication. Let me put my gloves on.
Hand hygiene is important.
It's very important. This medication is Breo. Breo is a combination of a bronchodilator and a steroid. The doctor explained to you what those drugs are.
Yes.
Okay, I'm here to explain you how to use it. First of all, you need to know that this medication has some side effects, which are headaches, runny nose, sore throat, and others which can be preventable. Like it's a fungal infection that can happen if you don't rinse your mouth after. And the way to avoid it is after using the medication to rinse very well your mouth a couple times and spit it out.
How likely is an infection to happen?
Well, if you don't do that or drink at least some water, it's a very high percentage of risk. Now, this is your Breo. This is your new medication. And we open it this way. You're going to listen a click. There it is. That means that the medicine is ready for you. And now you're going to have it. You're going to put it in your mouth, seal it with your lips, and breathe in as hard as you can. And hold it for 3 to 10 seconds. Very good. and put your head away from the device and let the air go out. Very good. Now, couple things. Immediately after that, you need to rinse your mouth. Rinse your mouth, and you can spit in the cup if you want, because I'm going to throw that away. Okay. Okay, thank you very much. Before you cover it again, you can dry it with a dry cloth, dry and clean clothes. Never let it clean it with wet stuff, because that could get into the medication. The medication is going to lose power. Okay, do you have any questions for me?
I don't think so.
It's very important for you to rinse after you're taking the medication, because you can have like a fungal infection in your mouth or throat, and it's called thrush, and we don't want that to happen to you. It's very painful, and it's preventable if you do this. Plus that, what I always recommend to everyone is if you don't want to do that every morning, you can also drink water, few sips of water, but this is a very good way to prevent that. Now, you have your medication, the need for you to have the medication is once a day, which is very easy to remember if you put it at the side of your bed, a bottle of water at the side of your bed, and you know what you have to do every morning, and this will help you to do not come to the hospital that often. If you want to come and visit, not come as a patient. Okay, nice meeting you, and if you don't have any more questions for me, okay, then
Thank you.
go home and keep with your medications. Oh, something that is very important for me to remind you is that this medication doesn't replace the other medications that you are already having. Okay? And this is not an emergency medication. This is a medication which will help you to do not have those flare-ups so often. Okay? All right.
I've written your discharge paperwork, so you're good to go.
Mm-hmm.
And did she explain to you how to use it?
Yes.
So why should you rinse your mouth out?
Because the bacteria. From
Exactly, yeah, the
Breo.
fungal, yeah, you got
Yes.
it. Yep, thrush, yep,
Thrush.
very good. And how often are you to take your medicine?
Once every morning.
Great, you know, that's the final lesson, that you know what to do. I'm just gonna listen to your lungs real quick, okay? Do a deep breath for me. Good. Again. I'm not hearing any wheezing, this is good.
That's very good.
Again. Okay, again. Alright, well, you're cleared, clean bill of health, so we'll get your prescription written and you'll be on your way, okay?
Thank you.
Can I do anything else for you?
Alright.
Alright, best to you.
Thanks.
Okay, take care.